It didn't read it. Yeah, it's reading now. بسم الله الرحمن الرحيم الحمد لله رب العالمين وصلى الله على سيدنا محمد وعلى آله وصحبه أجمعين. So how to talk to a spirit? How to talk to a spirit? Is there a spirit here? Anyone who wants to guess? Says no. We don't have young children.
Sitting in the chair.
Yeah, sitting in the chair. How about here? Any spirit? No. Sitting on top of the lady with the long. How about here? That's easy. The spirit.
It's a shadow.
And wearing cloth and things. So what is a spirit and how to prove you have a spirit and how to talk to a spirit? So what is a spirit? Ruh. Yeah, ruh in Arabic. What's ruh in Arabic?
Soul.
Soul when the spirit inside the body. Yeah? Sulaiman? Yeah, well, inside the body is called nafs or soul. Yeah. You know, they were asking black girls and boys to have less hair. It was on the news. Now they're saying no, they can have as big hairs. But sometimes they block the student behind them. I think that's fair, you know, because if there's big hair, I sometimes can't see my student. I ask them to move a bit to the right or the left. I can't see Sulaiman now. But what spirit now? Soul. What's soul? Soul inside the body. The spirit inside the body called soul. Ruh inside the body called nafs in the Quran.
Outside the body is a ghost.
Outside the body is a ghost. So was I right in this? That's a ghost. Yeah.
So, I mean, you can't see the spirit. So
it's a bit terrifying, isn't it, when people talk about it, while it is actually you. It's you. It's you, me, because you said I took my, the doctor operated on my body. I have a problem with my leg. Like we had a postgraduate meeting once, and a lady doctor was presenting a case, and the lady said she was 30 years old when she discovered that she was a man in the body of a woman. I said to her after that discussion, I said, what did she mean? I was a man in a body of a woman. What did she mean by I? Because in medicine, there's no spirit. They don't teach us to have a spirit and body. You have the body, there's illnesses, treat. There's no, mention to the spirits in medical textbooks. So when she said, I was a man in a body of a woman, what did she mean by I?
طالع على فيسبوك. طالع على فيسبوك. طالع على يوتيوب.
هذا الفيسبوك أحيانا لما يكون
يلا
previous session was on the Facebook.
ويجوز نكمل التسجيل نفس الريكوردينج.
Yeah, sometimes it does, yeah.
Just
see what happened now. It is the channel.
It won't let you do it whilst you're streaming.
Okay, we'll just leave it. Yeah, it could be. Sometime I found that it's linked to the Quran, so I need to split it and re-upload. Because how to prove you have a spirit? How do you prove? You must have heard this, Sulaiman, in the class. How to prove there is a spirit. If I look at you here, my picture disappears from the OBS.
It is in the Quran.
But you, how you convince yourself you have a spirit? People who don't read the Quran, how would you convince them? The atheist, the Christian, the Hindu, the Sikh. Easy, isn't it? When you sleep, your body go into hibernation, more or less. Blood pressure drops, your pulse drops, your temperature drops. But you don't disconnect. You're still there. You're aware of yourself. You're aware you're so-and-so. You know you're married. You know you're living in your house. You know your wife is not next to you, children in the house. You know you're going to wake up. And you see dreams. And you know it's dreams as well most of the time. Unless it's nightmare or something. But you know that you are in the body or out of the body sometime. And Allah Azza wa said, إن الله يتوفى الأنفس حين موتها والتي لم تمت في منامها. So the anfus will leave the body during the sleep, and then if they are supposed to come back, they come back to the body. If they're supposed to remain dead, they remain dead. Is it showing on Facebook? No. So when you are asleep, yeah, and sometime you might have to prove to yourself that it's Ramadan and you have to fast, so you control your brain. Your brain acts as an organ. When you are hungry, you eat. When you are thirsty, you drink. But if you have if you go to the supermarket, you wouldn't eat anything unless you buy it, unless you're desperate and you take it open to the till and I started eating this and you pay for it. But if you take your goat will start eating the green. They're not aware of till or paying or anything. So you have something controlling the brain, and the one who controlling the brain is your soul. And you go to the bank, you don't just take the money and go. You need to write your check and get the check accepted. What your card, the card accepted. So you're controlling the biological brain. But when you dissect the brain, it's all axons and cells and electrical signals going down and up the brain and things. They try to locate consciousness, and there are a lot of work. They couldn't find a center in the brain. They start talking about these microtubules there, and but they couldn't. Every center in the brain, every part of the brain has known function. But to have a function which you can just switch it off, and you are not controlling the brain, your conscious go. They couldn't find it. They might give you anesthetic to make the brain not responding to your spirit in a way. When you sleep, you disconnect from being controlling the biological brain. When you make the brain unusable by anesthetic, then obviously you lose conscious. And the same will happen when a person dies. The brain is not usable, so the soul will leave. How to talk to the spirit?
Higher peer.
Higher appear. Because if you don't know how to talk to the spirit, how are you going to treat your spiritual diseases? Now,
You're asking how to talk to your own spirit or how to talk to someone else's spirit?
you ask someone to talk to you.
I'm asking, are you asking how to communicate with your own spirit or someone else's spirit?
Yeah, how would I talk to your spirit? What sort of talk I will be doing to your spirit? What sort of talk? If I want to talk to your spirit, what sort of things I will be talking about? As a psychiatrist, when I see a patient, if he's depressed, I will look into, probably have a lot of either life events or endogenous genes or whatever slowed down the production of your hormones, or your hormones, neurotransmitters, hormones. They're not going from A to B to C in the brain to motivate you. I'm going to give you these tablets to increase the hormones, or we're going to give you this electric shock, or we're going to give you some cognitive behavior therapy, train your brain to be more positive, more active. But I'll be talking to his spirit about his body. Yeah? When I'll be talking to a manic depressed or a schizophrenic, I'll be talking to the spirit of that person about his body, why the body is functioning this way. Obviously, to convince somebody who have delusions, usually delusions are unshakable false belief, and that it will take time. Sometimes we might force the treatment to stop the effect of the extra hormones creating the delusions and the hallucination things, and then the patient will be with us. He will accept to take tablets. The thing is that sometimes they get fed up with the tablets or injection and they stop it without telling us, and they relapse, and then you're back to square one sometimes. So I had one patient once, and she wanted to have a baby, and we don't know what's going to happen. It's a bit risky, so I kept reducing her injections. She used to have 100 milligram every 2 weeks, made it every 4 weeks, then every 6 weeks, and 50 milligram, then 25 and 12 and a half. It took me around 2 years to take her off the drug gradually, because we were worried that he might relapse. When she was off it completely and she's supposed to get pregnant, 2-3 months relapsed back with the delusions and hallucinations. So that's make it difficult to speak to her spirit. But when there is no symptoms, you talk to them as is John and David and Ali, and talking to the spirit. So you need to talk to the spirit to get influence the spiritual diseases. So what are the spiritual diseases? Miserness, yeah? Yeah, because you have the money, you have the food, you have this, you have that, but you still don't give. They throw it away, but they don't give it to the needy, yeah? Arrogancy, a list of them. Being afraid of Allah Azza wa Jal, being wari', scrupulousness, and being zahid, being silent, quiet, being fearful of Allah Azza wa Jal, have hope. These don't generate by your biological body. It is generated by your soul, your spirit. When you have people commit sin, lie, and they have sadness because they are not super rich, or they're not super famous, or whatever. When they have loss and desires to do things and to eat things, and when they cannot stop their instinct desires, and they need to oppose their sexual drive, towards haram way, and when they envy people, when they're backbiting, they're all diseases of the spirit. So you need to talk to the person, split him from his body. I'm talking to you, and I know you can't change this because it's not generated by biological body. No one can say, this is the way I am. No, it's not the way you are. I can't change myself. You can't change yourself. There is a well-known story from the time of Prophet Muhammad ﷺ, when Abu Dharr al-Ghifari said to Bilal al-Habashi, Ibn al-Sawda, the son of the black lady. And I'm sure some of you know how he managed to get rid, because the Prophet ﷺ said, إِنَّكَ امْرُؤٌ فِيكَ جَاهِلِيَّةٌ. You still have a trait of ignorance. So how to get that trait out of your body? What did he do? Do you know? Any of you?
He asked Bilal to hit him.
Not hit him. Stone on his face. Yeah, he asked him. He said, and he wanted that trait to come out. It wasn't like, this is a problem, and I identified, the Prophet ﷺ told me about how to get rid of it. You can't go and take, antibiotic, or take a painkiller, or get some ECT or something. This is the spiritual disease. You need to get rid of it. So what you do, and This actually obviously studied in minute details, and I'm hoping to actually go through each one of them, because there's a lot of stories how to get away from sadness, how to get away from being always greedy and always following your desires, how to make your spirit humble to Allah Azza wa Jal, and be modest, and how to be able to control that, because you have natural desires built in to eat, or to look into haram views and things, or to be certain behavior. You need to really get to do it. Al-ghiba, it's a person who commit this. Al-hasad, to be contented, tawakkul, and al-shukr and yaqeen. So all these are the diseases of the heart, the diseases of the spirit. They call it the diseases of the heart because it sounds more heartly things, more love, and perception will be easier than saying diseases of the spirit. And the heart, it seems, the center of the spirit, although the spirit shows itself through actions of a lot of organs. In the Quran, Allah mentioned what Allah mentioned in the Quran. When your spirit in trouble, what will happen? Or when you are expected to be good, which organ you control? Yeah, the heart. ألم يعني الذين آمنوا أن تخشع قلوبهم لذكر الله. So is it the qalb who makes zikrullah, or the spirit making zikrullah, and the organ which represents the spirit is the heart? And what else? Let's go back to the Quran, and probably we need to switch this as well. So if we go to the Quran and look into a couple of sentences, Allah نزل أحسن الحديث. Allah sent down the best of the hadith, the best of the teaching talk. كتابا, which is the Quran. متشابه مثاني. تقشعر. So from the Quran, we read the Quran. تقشعر منه جلود الذين يخشون ربهم. So julud, your skin actually shiver and feel numbness when you hear something really mighty. ثم تذين جلودهم, again وقلوبهم. وقلوبهم. So جلود, your jilid, your skin, and your heart. إلى ذكر الله. And also what else?
The leg.
The
leg.
But is there in the ayah? Yeah, this is the ayah. فمن يريد الله أن يهديه يشرح صدره للإسلام ومن يريد أن يضله يجعل صدره ضيقا حرجا كأنما يصعد للسماء. يشرح صدره. So your chest will become like open, relaxed. You're breathing quietly and nicely because you're really contented and you're full of happiness, and especially subhanallah, when you go through a difficulty or tribulation or some difficult time and you make dua and Allah Azza wa Jal shows you He responded to that dua, you become more pleased that yes, Allah is not angry with me, Allah is happy with me, He allowed me, got me off the hook, or He managed to get me out of the trouble. So your sadr is also mentioned in the Quran. كأنما يصعد في السماء. So if he is unbeliever, there will be tightness in his chest as if he is going up in the sky. Why is that? He's going up to the sky. When Marwan went with Asad and Samir to Kilimanjaro, yeah, they said to them, some of you might not stand the reduction of oxygen concentration. And if we feel there is a sign of any pulmonary edema, they will take you down. So halfway up, they took Samir down. So Samir didn't go to the top of Kilimanjaro because he started having a massive reduction in the oxygen. His lung couldn't tolerate it. so they had to carry him. And the thing is that it's a mountain, so they wrap you on the stretcher and tie you and run. It's not like they walk slowly; they run with the person down. So when you go up, you have less oxygen and the chest become very tight. كأنما يصعد في السماء. So back to the PowerPoint. الصدق the same, استقامة, الرضا being satisfied, المراقبة being aware of Allah Azza wa Jal, الصبر patient. It's all these actually the spirit has to exercise that, and the spirit expresses itself through the body. So when the body is usable, like I was telling my wife, when now observing so many grandchildren, they know far much more than what you think they know. And some of them might be given a gift of talking, make themselves understood quicker. My granddaughter Liane, she's be able to express herself, and many people get amazed. She say full sentence, nothing missing from it. And I used to take her with me shopping, and talk to her, put the books and things, and probably she picked the language very quickly, expressing herself. And like she picks the phone, you wouldn't know whether she is talking, and she's 3 years old now, or her sister who's 9 talking. The sound is the same, but she make full sentences. So the spirit's able to use the body, but they get angry when they are younger because they can't use the body, and they want something and they shout and they scream and you don't know what they want, and they get angry and you give them something different and battle. And the same happen old age. When they become demented, many of them, they can't express themselves, and we ask a battery of questions about nearly everything. Could be in pain, could be toothache, could be joint ache, could be backache, but they can't express. The brain is more like atrophied, and there's few brain cells, and they can't express what they want, and people give them something different or give them opposite to what they want. They want to go out for a walk, to put them in a room. They hate that food, they give them that food. I went to see a patient once in one of the medical wards, and they said that she's refusing to eat or drink, and we asked her and she wouldn't. And I came assessed her, and I said there's nothing wrong with her. She's not demented and she's not depressed, but she lost her executive functions in the frontal lobe. So if you come to her and say, would you like coffee or tea? She wouldn't reply. If you put coffee and tea in front of her, she will take the coffee. She likes the coffee. If you ask her, would you like mashed potato or fried potato or chips? She has no ability to express herself. As one of them, I did mini mental state. This is a short exam we do, and she scored 3 out of 30. 3 out of 30 means that she must be in a nursing home, in the end stage of dementia. But she's living alone at home. So I sent an OT to see her at home and the social worker, and they came back and they said she automatically wake up and do everything safely, from washing and dressing and making breakfast. She cannot express herself. Which day is it today? No idea. Is it morning or evening? No idea. Are we in the summer or winter? No idea. Who is on the throne? Have no idea at all. She scored 3 out of 30. It's nothing, but she automatically, but the spirit is there, and the body went into like automatic drive, auto drive. Now,
Is that a lack of ability to express themselves or a lack of ability to make a decision?
no, they lost the brain centers where they used to execute all these things and use the language and express themselves, and that's gone. And awareness, insight and awareness. But the way of life became like more automatic. She used to do it for 40 years, and she will do it for another 10 years. The opposite happened with men. If they are not been doing anything in the home, when they get demented, unless somebody live with them, they need to go to a home. They have no idea that he has to eat or drink, where the food is, where is the sugar, where is the salt, where is this. It would just totally blank. And women who have been housewives all their lives, they stay safe. No
Yes.
major issue. They remain safe in their houses. So the thing is, you get you to the spirit is when you talk to children, when you talk to elderly demented, the spirit is there, um, but they can't express themselves. When they die, the Prophet ﷺ, when he spoke to the dead kafirin in Badr, the Sahaba said, "Are you talking to the dead people?" He said, "You won't hear better than them, but they can't speak because they can't use the body. Body gone, can't hear you. But when you sleep, all the body is unusable except your hearing. You wake up because of the alarm clock or somebody shouted."
The example you gave was that you gave her tea or coffee, but she chose the coffee. And she didn't.
In that lady, she lost the executive functions. She can't make decision, coffee or tea.
She can't make.
Yeah, but the mood was fine and spiritually was okay. It wasn't like, um, the patients clash with the staff or the relatives because the spirit is intact. These are the diseases of the spirit. Truthfulness and being generous and being straight, but they clash with the staff. The spirit is okay, but they can't express themselves. And if you are not expert to find out what's they're missing, what they want, you clash with them. They might become aggressive. They might become withdrawn. They might become disturbed, and so you need to have a battery of questions. Like when they had the baby, you gave them the list of 20 points. They go through the list. The last one called dad and mom. So the last one, you go over the 20 points. Hungry, thirsty, need cuddling, cold, too hot, need to be on a hard flat, need on soft flat, need so many things, wet, soiled, dehydrated, whatever. You need to go through the list because you're not going to. Some people are trying to say, oh, this the type of the cry could tell you something about the baby. But when you go to the other end of life, the spirit is there. There's nothing wrong with it. But the body is unusable. They can't express themselves and they can't tell. And then they get some deprivation of their senses, the eyes and the ears and the hearing, and they start misinterpret things or not understand it, and that makes things even worse. But because the spirit is there, they get complication like depression and anxiety, aggression and withdrawn, refuse to eat or drink, and become go on strike, but they can't tell you why. So if you are keen, we could go through the diseases or qualities one by one, which is part of the Risala Qushayriya. When I started the Risala Qushayriya, was it's a book, but it took the scholars who gave the meaning of it 120 hours. So I was hoping to finish it in 10 hours. It wasn't possible. So this part of it. So when you go over all these points, you really become like purified spirit, purified soul, purified heart. Now,
So one of the things which I learned from one of my teachers is that instincts are what the body wants. So if you are hungry, instinctively your body wants to eat. If you're thirsty, your body wants to drain, and so on and so forth. So that's an animal instinct. And we are animal, so we do have animal instincts. So if your body is stronger, then they will do like animals. So whatever you want, you will do it. But if your soul is stronger, then you will listen to the soul, and soul will stop you from doing things which are not appropriate. So yes, you want to eat, but it's Ramadan, you won't eat because your soul will control.
yeah.
But if your body,
Freud, when he started talking about the I, ego, and superego, he didn't want to take from the religion. He stole it from religion. I, ego, and superego. So you have the Like you need to live a normal, ordinary Muslim. You eat and drink and you fast in Ramadan and you fast some other days and things. Um, and you eat the halal and you avoid the haram. When super ego, when you go to the ihsan level, you give what you have because you want your Muslim brother to be happier, and you feed that because you know you had food yesterday, you can't stand for 2 days, but you give him the food of today to him. So that the super ego, the moral level, and um, so in Islam, because there is a lot of ayahs and hadiths how to shape the spirit, you succeed. Now,
What does supplicatory mean?
what is does what the
37.
I think it means supplication.
which one
Number
Dua.
37.
number?
37.
Oh, 37. Supplicatory dua, to ask Allah how to supplicate, yeah, how to ask Allah for things. Al adab, how to behave when you are traveling, how to behave with friends and companionship, um, how to prepare yourself, you know, closer to death and things, how to be knowledgeable of Allah Azza wa Jal, about love and shawq and things. Right, this is tempting you to accept that we go through these will be from the Risala Qushayriyah topics, and in between people want to chip in and talk about a subject, then it doesn't have to be as serious. We can have it alternate week or whatever. So it's a project for um, the near future, inshallah. Sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Any questions? Any comment?
I just think that along the lines of Dr. Mustafa is asking, and I'm sure maybe certain professions like medicine, you have to make very critical decisions, very important decisions. It's a matter of life and death. So thinking skills, the way you think, it must be very important. And I'm looking for a lowest common denominator. For example, if you take, I heard from someone who had depression, and they said that, I don't know whether how medically true this is, but people who have depression, their part of the brain, I heard that makes decisions, that part shrinks. So when they're given an option of, do you do A or B, they find it difficult. Now I'm looking for, how can I say, is that you have to have a way to think. For example, we know that as a Muslim, certain things are approved, other things are disapproved. But you have to put that in place before you start to build on all of the technical details.
Yeah, to answer your question is actually need to take one by one. Depression doesn't mean that you lose the ability to make decisions. Your brain slows down. When your brain slows down, it might take you longer to make decisions, but you might know exactly what you want. Executive functions, when you have the atrophy in the frontal lobe, or if somebody has frontal lobe dementia, or people have some tumor or whatever, frontal lobe is more in the command center where we make decisions about A, B, or C, or D. And that's might not be the best. He's lost the ability to make the right decision and then choose executive functions. Most people go through executive functions syndrome or loss of executive functions when they pass the 65, 70. That's why they retire. But they become liability for their employers. They are supposed to come to work, then they know what to do from A to Z. And they sit there what to do next. You've been doing it for 40 years, but now he lost that ability. When it comes to use your logic and your common sense to run your life, the depression slows your brain and become difficult for you to dig in your brain and find out the motivating items and the motivating memory. So when we come to a depressed person, we'll say your job to go home with your wife or your children or whatever, try to remember all the happy time in your life. what you've done, what you achieved, all these courses you went, all these qualifications you had, all these races you won, all these painting you had, and keep writing all these, exotic holidays, whatever. If it comes a negative part of your life, write it on the other end of the book, but never read it again. So every day read all these positive things in your life, trying to train the brain to become more positive. And the other side, just, I know about it, I don't want to read it. You just leave it. And logic and common sense, and we teach people how to think logically, like I mentioned when I talked about depression, that somebody well depressed, he's going to die, he's going to have a heart attack, and then why you think, how much you are convinced, or 90%, why you're convinced. Do you have high blood pressure? No. Do you have high cholesterol? No. High triglyceride? No. High uric acid? No. Are you overweight? No. Do you have a family history? No. Do you have this? No, no, no. So why are you convinced? So how much you convinced now? 50%. So when you go over this similar things, I'm going to lose my children. My son's going to have this. Why? Give me. Did you have any doctor told you? Do you have any MRI scan, any blood test, any this, any this? No, no, no. Why is having? Because the brain become more prone to negative things. By default, the man, like what Dr. Mudassar saying, by default, the man goes into the instinct behavior, that he doesn't want to walk if if somebody can bring him the food, why to bother? He will eat whatever there, whether his or not, and so he goes to instinct animal behavior, what they Freud called the animal behavior, and then you need to shape that, and religion comes to take you to the super ego, to control your extinct behavior. That's haram, that's not allowed, that's not yours. You will be punished by the law, you'll be punished by Allah Azza wa Jal, and try to sharpen the spiritual side of the person, the spirit who's controlling the brain. Because the brain demands from the person, oh, I want to eat, never mind Ramadan, I'm just hungry, whatever, never mind, it's not mine, or never mind, it's so they we want a fancy car, you just go and steal it. So he's just a victim to his. Many of the, subhanAllah, many of the Muslims who went to prison, they converted a lot of prisoners because they managed to get this ability to control the criminal instinct in them, that no, you can't do this, Allah will punish you, especially like murder, or is it rape or something. But yeah, we need to break it down into things, and some are usable, treatable by medicine, some are treatable by common sense, some are treatable by religion. You need to enforce the fear of Allah.
I think what I'm getting at is that, at one time logic subjects like logic and reasoning were actually taught, and in mainstream, that's not taught anymore. Maybe in some elite schools,
Yeah.
somewhere it's still taught.
Yeah, when the brothers did the course